I mean different patterns are shown over the slides. If it's a ferning pattern like a fern leaf, then the patient is ovulating. Okay. According to that, you will plan, or the patient will plan for intercourse and all. Another is their basal body temperature. Temperature rise, morning temperature, and what else? When does it rise? Why? Why does it rise? Yes, you're telling the truth. Why does it rise? Because of a certain hormone. What hormone? What hormone? Temperature. No. Estrogen is there. Along with it, another hormone is there. That is cortisol. Cortisol hormone. Okay. So, basal body temperature is there. Coitus interruptus is there. What else is there? Lactational amenorrhea. What does the mother complain during the lactational period? What does she complain? What does she come with? She is exclusively breastfeeding her child, right? After normal beat cesarean, she is exclusively breastfeeding. The baby is not getting any other milk form. Okay, ideally we should exclusively breastfeed the baby, right? If the baby is not getting any other source, which means the baby is being exclusively breastfed. So in that case, the patient may complain of what? Amenorrhea only. She will come to you with the complaints of, I have not been menstruating since the last 3 months or 2 months. Madam, our last mashik hoyechilo 2 মাস আগে. So how will you make the patient understand? You will have to make her understand that during this period, due to the action of the hormone prolactin, there might be some amenorrhea features or some dysfunctional uterine bleeding or spotting throughout the lactational period. So that's a normal thing. You can tell her that it is normal to have a irregular menses during the lactational period. Okay. What else? Mostly these are the things. Okay. Beads used to use in ancient times, not now. And that's all. Then barrier methods. What are the things used in barrier methods? Yeah, male and female. First, you have to categorize the male part and the female part. Okay. In male, what do we use? Nirodh or condoms. Yes. That is the only thing. Anything else? No. In female, various things. Various things are there. Like sponge, diaphragm, very good. And female condoms, exactly. How does it differ from double ring? Double ring, one. Yes. So this is whenever you will be given any kind of a drug or anything of that sort. First, you have to identify it. First, take it in your hand and then say what I'll just ask you, what is this? You have to say what is that. Okay. According to that, we will question you. So first, let me give you this one. What is this? Intrauterine device, not copper. Why? You will say what is the main category of that device. Okay, it's an intrauterine device, contraceptive device. Intrauterine contraceptive device. Okay, all intrauterine contraceptive devices are not made of copper, right? What is the device which is not made of copper? Do you know the name of the device which is not made of copper? Yes. Another one? আরেকটা শুনতে চাইছিলাম। No, not progesterone. We don't use it nowadays. Yes, lip is low. Lip is low. Yes. So it's a intrauterine contraceptive device. Jeta lekha ache, just say it. Okay. Sterilized intrauterine contraceptive device. It's all written. It's a big clue. Everything is written. Whenever you will pick up the strip, you will just ja lekha ache setai outa gelei hobe. ঠিক আছে? Then after that we will cross you. Then the real game begins. So, acha. What are the things you have to know about any intrauterine contraceptive device? First is, what are the uses, contraceptive uses and the non-contraceptive uses also. Okay, what are the uses? Main is contraceptive uses, right? In kind of which scenarios can we use? After normal delivery, after cesarean. After cesarean, what do we say? Post placental insertion of the copper T device. Post placental insertion. Okay, because just after the delivery of the placenta only we are inserting the copper T. সেটা সিজারিয়ানের পরেই হোক বা নর্মালের পরে হোক, we use it, we insert it with the help of that forceps. Anybody knows about the name of that forceps? We insert this intrauterine device with the help of a specific forceps after delivery, after cesarean or normal delivery. Why? Why do we insert with the help of a forceps? Because the uterus is, yes, it's larger in size and the os is also partially open. So we will always need another forceps for insertion of the copper T. What is the name of that forceps? Kelly's forceps. K-E-L-L-E-Y. Kelly's forceps. So we take it out. We take out the device. We place it in the flanges of that Kelly's forceps and we insert it inside the uterus. Okay. যতটা অবধি যাচ্ছে ততটা অবধি. Until unless it's we are forming a hindrance, ততটা অবধি তোমরা Kelly's forceps কিন্তু ইনসার্ট করতে পারো. ঠিক আছে? Kelly's forceps ইনসার্ট করে forcepsটা বার করে you have to check for the threads. Okay? If the thread is coming out of the introitus, you have to cut it like 2 to 3 centimeters so that the patient can feel the threads always. ঠিক আছে? We do it like that only. And things are different in case of a patient who is having just having a delivery and we are inserting, and it's very much different from a patient who is non-pregnant. Why? Because the uterus will small ke ki bole involution. Uterus will involute, right? So in the process of involution, the thread will also elongate, right? It will come down, the thread will also come down. So in case of a post placental insertion, we cut it twice the, I mean আন্দাজেই করতে হয় ওটা. There is no guidelines as such যে এতটাই সেন্টিমিটার কাটতে হবে. Different books different পাবি. So we have to in a non-pregnant state, in a gynae patient, we cut it down 2 to 3 centimeters away from the introitus, and in this double of that. Okay. What are all the other intrauterine contraceptive devices other than CU375? One you told Lippis loop. Yes. But 375, another is 380A. Right. This is ভালো করেই জানিস তোরা, আমাকে বল কি ব্যাপার. Why 380A? Surface area. Arm. It's present in the arms also. The copper turnings are present in the arms also. Okay, এটাতে দেখবি কোথায় আছে, স্টেমেই আছে, মেইনলি স্টেমে আছে. Okay, so the difference between CU375 and 380A is, what are the differences? Tell me. There are many differences. First is surface area, 375 and 380. Arms হয়ে গেল. What else? Lifespan. Yes. Expiry. Yes. 10 for 380 and 375. 375 যেহেতু primitive তাই কম, that is an advanced one, so it's বেশি. ঠিক আছে? And what else? তার জন্য কি? What? Due to the structure? What doubt? How do you insert this? How do you insert this? Plunger. That is the main difference between 375. That is the basic difference you have to know. Whenever you are inserting a 375, CU 375, how will you prepare the patient? First is the preparation of the patient. Yes. Ideally, lithotomy position. Bladder is emptied. Dressing draping is not that much needed in these cases. Okay, it's an office procedure. She will come to you in the OPD. Ami property porbo. You have to prepare the patient and insert the property. Right? It's not a operative procedure that you have to take her under anesthesia and this that. Okay, it's an office procedure. You can do it in the OPD. So, what will you do? Here you can see there's a hollow tube. Inside this copper-T device is there. The length is up to this only. Oh, ikun dike mon. Eitukui length thake kintu. And after that, there are 2 threads. Immensely long 2 threads are there. Okay. So how will you insert it? Initially, you can tell the patient to take a painkiller or so, like ibuprofen. You can prescribe her half an hour before insertion so that she doesn't feel any pain while insertion. Okay. Then what else you can do? In which patients is it indicated? At a primary, she has never been pregnant. Can you insert it? It would be very difficult. It will be very difficult because the cervix has not ripened ever. You have to ripen the cervix and then give it then. You have to ripen the cervix with a misoprostol and then give it. It's not indicated, that much indicated in a primary. Okay. In a second gravida, she has already been pregnant. Okay. What are the difference between os of a pregnant and primary and a parous os and a non-parous os? Parous means she has been pregnant before. Parous means she has been pregnant before. Non-parous means she has never been pregnant. Non-parous is slit-like. Slit. Slit means this. Slit means this, which means it's a parous os. Pinpoint is non-parous os. It's a common sense. So if it's a parous os, parous माने हिंदी बांग्ला में हम लोग क्या बोलते हैं? पक गया है, पिके गए, parous, पका, ठीक है? So which means it's a parous os. It's already patent. There is a passage টাকটা হবে, তাই জন্য it's easy for insertion of these IUDs. Okay, in a parous os. 375 we directly inserted. There is no plunger available. দেখছো? There is no plunger. Plunger একটা আরেকটা এরকম স্ট্রিপ থাকে যেটা এরকম গোল মতন থাকে, ধরার একটা জায়গা থাকে. There is no plunger available. Just this rod is there. Okay. So why 375 doesn't need the plunger? Because the arms, there are no arms. This is a irregular surface, silastic, made of plastic, right? Plastic eri puro byaparta. So you can directly insert it. Directly insert coldly, fundusically, you will find a resistance. How will you? What is this blue thing? What is the name of this thing? Guard. Why? কেন কি? তোমাকে যতটা you are inserting it inside, you will get an idea about the length of the uterus cavity. Okay. So এইরকমই আছে, এরকমই প্রথমে তোমাকে মেজার করে তারপর তোমাকে যখন রেজিস্ট্যান্স পাচ্ছ তারপর তোমাকে এটাকে আবার বার করে নিতে হবে. In the meantime, this will be inside. The device will be inside. According to that, measure the guard. মানে কেন কি গার্ডটা কেন দিচ্ছে? আরো যদি আমি force we apply it, the uterus will perforate. It is acting as a guard. Okay. Up to this, you are finding the resistance. Then take the device out. Take this thing, circular cylindrical thing out. The copper T will be its certain place, exact place in the fundus of the uterus. Okay. Guard the, you will measure just. Okay. Then you will pull it out. CUD will be inside. Then you cut the threads. ঠিক আছে, নিজের মতন নন প্রেগনেন্ট মানে হলো তো ওটা that will not shrink, uterus won't shrink, right? So accordingly you will cut according to the gynecologist's experience. And if it had been a post placental insertion, আর একটু বেশি কাট করতে হবে, ঠিক আছে, 4 to 5 centimeters. This will need 2 to 3 centimeters according to your choice. Acha, so in a CU375 you will just directly insert it inside the os, but in a 380A what will you do? Plunger will be needed. Why? आर्म को क्या करना है? बोला? Yes, we have to fold the arms and tuck it inside the cylinder. T avasthate you can't insert it. Yes. Plunger, why is it used? Because initially what will you do? T আছে, T টাকে bend করে এটার মধ্যে ঢুকিয়ে নিতে হবে, ঠিক? হ্যাঁ, then insert it inside. Okay, guard, measure the length of the uterus. Then এটা কিন্তু আরেকটু বড় হয়, এই যে তোর সিলিতে the volume, I mean the circumference is larger than this, তো তার মধ্যে প্লাঞ্জারটা ঢুকে যেতে পারে. What will you do? You will keep that thing in the uterus, তারপর পাশ থেকে প্লাঞ্জারটা এনে করে ঢুকিয়ে দিলে যেই প্লাঞ্জারটা ঢোকাচ্ছিস ভেতরে কি হবে? ফ্যান আউট হয়ে যাবে, টিটা বেরিয়ে যাবে. Then take this thing out like you did for a 375. Okay. Okay. So 380, it lasts for 10 years. 10 years. Okay. What are the other intrauterine devices you were telling? Mirena. Okay. Initially, tell me, these are the contraceptive uses I told you. What are the non-contraceptive uses? What are the indications? What are the contraindications? Everything be good. Accidental prevents pregnancy mane unwanted pregnancy, right? Unwanted pregnancy. That within how many days? 72 hours. Yes, very good. Within 72 hours, if you insert a copper T, then that pregnancy will be prevented. Why? What is the action? Foreign body ache, so it is gametogenic. It kills the gamete. The copper, the free radicals come out and they kill the gametes. Okay. And what else? What are the indications? Other indications? Very important indication. Have you heard of Asherman syndrome? Asherman's? Ke shoneni? Raise your hand. Asherman's. Asherman's. It is a result of excessive curettage. Excessive curettage means the patient will give typical history of 2 or more than 2 pregnancy losses, followed by dilatation and evacuation. Okay. She will typically give this history and presently complaining of amenorrhea. Why? When you are vigorously curating the endometrium, what happens? Adhesion bands appear in between the endometrial cavity and the whole of the cavity is occluded due to the adhesion bands. So, the patient is not able to menstruate properly only. The menstruating blood get trapped in the all those places, all those adhesions. So, the patient will complain of, typically she will complain of dysmenorrhea, but amenorrhea. She will get the pain, she will get her symptoms of dysmenorrhea, but bleeding won't be there. Why? The blood gets trapped in all those adhesions. It is called Asherman syndrome. Okay. So, in Asherman syndrome, what do we do? In the surgery, we do adhesiolysis. Adhesions are there. What do we do? Ideally, we insert a hysteroscope. Hysteroscope is a camera we insert through the vagina, cervix and endometrium. Then what do? Hysteroscopic scissors are there. Scissors there we do adhesiolysis. We cut all the adhesions. And after that what do? We insert a copper tube so that further adhesions don't take place. ঠিক আছে, এটা মাথায় রাখবে, এটা কিন্তু কোশ্চেন করে। And what else? আর কোথায় কোথায় ইউজ করব, আর কি কন্ডিশনে, and what all conditions? If she is having any abortion, if she is having any abnormal uterine bleeding, we can use, okay. And what else? Any kind of irregular menses, we can insert a copper tube, okay. But what are the contraindications? Yes, PID. Why not? Why not in PID? You have to know why. Not bleeding. Infection already is there. Yes, it might cause. And what else? What else? Any abnormal bleeding, any kind of abnormal bleeding already she is having, already unexplained abnormal bleeding, unexplained bleeding, you can't give. Any kind of carcinoma, cervical carcinoma, you can't give. Uterine carcinoma, you can't give. These are all basic things. এগুলো just মাথায় রাখবে। Okay, এই গেল তোদের IUD. Acha, tell me about LNG, Mirena. Something about Mirena. Mirena indication is is there. How much? LNG 20. Acha, কত micrograms per day release হয় জানতে হবে। 52. Okay. Acha, when it is indicated? Which is abnormal uterine bleeding, dysmenorrhea, irregular menses, you can give. And when can you not give? Levonorgestrel is what? Estrogen or progesterone? So, in what all conditions it's contraindicated? যা যা বললাম সেগুলো তো আছে, তার সাথে if she is having any metabolic syndrome like hypertension, dyslipidemia, in all those cases, we give LNG IUD in mainly elderly patients. So, yeah, in elderly patients only, who are all, দেখো estrogen অনেক মানে debilitating factors আছে. Estrogen is more harmful than progesterone বলতে গেলে. So, in higher age group, we avoid estrogen as much as possible. We give progesterone analogs, progestogens. Okay. So LNG IUD, Mirena insertion কেমন হয়? Mirena, anybody has seen a Mirena? Nobody has seen. Okay, Mirena, it's a তোদেরকে একটা ফটোই দেখাই তাহলে। Mirena technique is totally different of that of copper T. We have to load a Mirena first. It looks like this only, white মতনই থাকে, ঠিক আছে। Copper T যেহেতু এটা 380A বুঝতে পারছিস, this doesn't have any copper component. It's like this. বুঝতে পারছিস? Everybody can appreciate. There is a ball like structure and at the end there is a Mirena. It is a ball like structure, যেমনি আমরা ভলিউমের নব টাইপের ওপর নিচ করি, knob like structure, and Mirena is at the end. There is also a guard like this only. What do? We have to first load the Mirena. Mirena load করার জন্য কি করতে হয়? We have to push it forward. Whenever you're pushing the bead forward, the Mirena gets loaded. মানে ভেতরে ঢুকে যায়। উল্টো। সামনে মানে ভেতরে ঢুকছে। Then you insert it inside the os and then what do? Backwards. Load করে ওখানেই রয়ে যায়। তারপর আস্তে 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 like a copper T only. No. একবার চেঞ্জ এটার 5 years তোরে হয় effective, ঠিক আছে? After that, if she doesn't have any problem, we will cut it out. I mean, we will smartly pull it out. How do we take out a copper T? অনেক copper T আমাদের কাছে আসে, আর copper T ভালো লাগছে না, এ হচ্ছে, অসুবিধা হচ্ছে, ব্লিডিং হচ্ছে, ইয়া থ্রেড টেনে দেব যদি না পাওয়া যায় থ্রেড। রেডিও পেক্সো কি করে দেখতে হবে? টেল মি। A patient has come to you that ma'am, I can't feel my threads since 2 months, okay, and I've missed my periods. What will you do initially? আগে UPT টা করতে দে, প্রেগন্যান্ট কিনা দেখ। UPT, okay, urine pregnancy test, okay, it's a negative one. So it will come to your mind that where is the copper T? Is it in its actual site, or has it gone somewhere else, or has it come out when she was sleeping sometime and when she got বেরিয়ে আসে, অনেক বেরিয়ে আসে, প্রচুর বেরিয়ে আসে। So she had come to you, I can't feel the threads, this, that, so I want to know, I'm very anxious, where is my copper T gone? So what will you do? Initially you'll do our senior colleagues used to do radiographic examination, like a X-ray, a plain X-ray, okay? But now we don't do X-ray because not exposure. SG, over an X-ray, you can find if it is inside the endometrial cavity or not. In an X-ray, will you be able to elicit the endometrial cavity or the uterus or any adnexa? Nothing. ওটা perforate করেও তো চলে যেতে পারে অন্য জায়গায়। It's in the abdominal cavity, but you won't be able to find, right? So you have to do a ultrasound investigations. You have to do an ultrasound. Ultrasound এ যদি থাকে যে IUD in situ. In situ means it's in its actual place. Then nothing to worry. Reassure her that it is in its actual place. Sometimes you have to do some investigations twice a year or once a year for your mental peace, nothing else. And after it has expired, like 10 years has gone down the line, she is not able to find the threads only. So you will prepare the patient, you will give proper anesthesia, and you will bring out the copper T. Okay, because the thread is not available, you have to take the patient under anesthesia and then take out the copper T, right? Okay. If there is a copper T, UPT, ঠিক আছে? UPT ধর copper T is in situ and UPT is positive. It can happen. What do we do? What will you call it? Failure. Contraception failure. 100 women year সব কিছু জানা আছে, হ্যাঁ, everything is known, Pearl index is known. What is Pearl index? Number of accidental pregnancies into 1200 by number of 100 women year exposure. Okay, now she has become pregnant. IUD is there. Will you continue the pregnancy? Will you continue the pregnancy if the copper T is there? Okay, Jigesh. No, from your point of view, tell me. Have you seen any photo? I saw a photo where the baby is catching hold of the copper teeth and coming out.
Champion.
Yes. So it's not contraindicated. It's not contraindicated. Once the patient is pregnant, you will just reassure her and properly monitor her. If her vitals are stable, if it's not causing any perforation or anything of that sort, you can continue with the pregnancy. Okay. But now, if it had, তুমি দেখছো, copper is not in situ, you have done a X-ray. After that, you have to do an X-ray. If you don't find the copper T in a USG, you have to do an X-ray. Why? Perforate করে গেছে, ঠিক আছে? আচ্ছা, in X-ray you have found it. What will you do? It is perforated in the দিয়ে বার করে নিতে হবে ওটাকে, তাই তো? Let it be. It's not causing anything. If she is not having any symptoms, signs and symptoms of intestinal obstruction, let it be. যদি না উইলসন্স থাকে তার okay, so there is nothing hard and fast that it has perforated, you have to take out that in that sitting only. If it is causing any signs of obstruction or peritonitis, then you have to find for the copper T and take it out. Okay, you can do a diagnostic laparoscopy only. Diagnostic laparoscopy করে you can, that is the treatment of choice. যদি তোমাকে বলে যে হ্যাঁ it's causing any symptoms or anything of that sort, you have to find the copper T, do a diagnostic laparoscopy and check for the IUD. Okay, okay, IUD নিয়ে অনেক কিছু হয়ে গেল, LNG IUD হয়ে গেল, সব কিছু হয়ে গেল। এইবার this one, what is this? DMPA, depot না, depot. রেটিনার আমাদের এতে পাওয়া যায় না, যেগুলো তোদের জিজ্ঞেস করবে। This is, tell me the whole, what is this? I'm asking you a question, what is this? Another beautiful name is there. Under which category? No, Antara is there, but there is another name. It categorizes, it falls in that broad category. It is a long-acting reversible contraceptive device. Contraception, LARC, LARM. Okay. So it is a, what is this? Medroxyprogesterone acetate. What is the dose? How will you give? দেখে নে, দেখলেই হয়ে যাবে, ওসব না দেখে দূর থেকে বললে হবে না, দেখে বলতে হবে। আচ্ছা, এটা সার্কুলেট করে দে, এটা দেখতে থাকছো for 3 months, then after that she will become pregnant. How do we give it? IV, subcutaneous, intramuscular, deep IM. It's very painful actually, so we give it deep IM. 150 mg once in every 3 months. Okay, that is the contraceptive dose of this Antara দেখবি health center এ তোদের কাছে patients will come with a card. In that card it's everywhere mentioned about the date. All the Asha Didimuni, what do they do? They keep a record of all the patients, when which patient is getting Antara, when they record it over there. They maintain a record book, and a card is also present with the patient also. She follows that Antara, I mean that Asha Kurmi, after 3 months. In that particular date, she goes there, she takes the injection and then she comes back. Every 3 months she has to go on that date only. Okay, they are provided with a record slip. So what are the indications? Any kind of all these kind of contraception indications are all abnormal uterine bleeding, ঠিক আছে, prolonged menses, dysmenorrhea, everything you can say. Okay, and what are the contraindications? Pregnancy, exactly. And what else? What else? Any carcinoma, huh? Any carcinoma. And okay, what are the side effects of Antara? Side effects? Long term. সে তো সব ইনজেকশন, হ্যাঁ সেই ব্যথা হয়ে গেল। Long term side effect, Antara? Patient gets very much irritated after this. What does she complain of? Irregular menses. Irregular menses with spotting. Irregular menses. Heavy menses, huh? She's having heavy menstrual bleeding. Due to any endometrial cause or ovulatory cause, you have given, the bleeding has subsided, but she will complain of amenorrhea. মাসের পর মাস she will আমার তো মাসিক হতে বন্ধ হয়ে গেছে মাস। Again, what you have to do? You have to do a UPT because failure rate is there. Then if it is negative, এটাতে কি হয়? Endometrial hyperplasia হয়ে যায়, তার জন্য তোর amenorrhea হয়ে যায়। So you have to counsel the patient. Spotting হবে তোমার, ঠিক আছে? Spotting is also a side effect of Antara. So ওই gather approach তোমাকে নিতে হবে, হ্যাঁ? Gather approach কি? Gather नहीं पढ़ा? Gather, greet, ask, treat, help, gather approach করতে হবে। ওই মাঝি স্যারের বইতে আছে, ঠিক আছে? Reassurance এসব আছে। You have to, cafeteria approach তো আছেই, you have to give her options, choices, whatever is suitable for her, because okay, so Antara side effect is irregular menses, amenorrhea and spotting. These are all the side effects. Only this is dealt with. What is this? Hormonal or Centroman or Chaya or Saheli. Many names are there. Saheli is that's a I mean this is free of cost, but Saheli you have to pay. Okay, this is a government supply one. Centroman, it is actually সব কিছু লেখা আছে, like non steroidal oral contraceptive pills, ঠিক আছে? তো পড়িয়ে দেয় বসে বসে পর। সিডিআরএল লখনউতে তৈরি। আর yes, and what else?
ব্রেস্ট ক্যান্সারটা বাড়িয়ে দেবে চান্সেসটা, মানে ডায়াফ্রাম যদি কাটি উপর দিকের গুলোতে বাড়িয়ে দেবে, নিচের গুলো কমিয়ে দেবে, এরকম।
Any kind of oral contraceptive device or pill increases the chances of breast carcinoma and endometrial carcinoma, cervical carcinoma কি না, endometrial carcinoma। And what are the contraceptive, I mean কি করে তোদেরকে এটা দিতে হবে? What you have to counsel the patient, when will she, I mean which day, dosage, everything you have to explain to the patient. What are the dose, what is the dose, actual dose of Chaya? It is very important, 30 করে থাকে, 30 mg করে থাকে dose, and how to use, when to use, that is very important, because এইগুলো কি, এই যে মালা N বা ওভারাল D বা ওভারাল G যাই হোক না কেন, this you have to take a prolonged thing, ঠিক আছে, for many days, but it has got a specific day of use. First, এই যে এখানটা সুন্দর করে লেখা, twice a week for first 3 months. This is a contraceptive dose of Centroman. Okay, twice a week for first 3 months, once a week for after 3 months. তার মানে কি বলবো? ও এই স্ট্রিপটা নেই, ওটাতে সুন্দর লেখা ছিল, সুন্দর লেখা থাকে এটাতে পেশেন্টের সুবিধার্থে, সাহেলিতে লেখা থাকে, সরি ছায়াতে লেখা থাকে না, সাহেলিতে লেখা থাকে when the patient has to take it twice a week, মানে ইফ শি স্টার্টিং মেন্সেস হয়ে গেল, মেন্সেসের পর থেকে যেদিনকে মেন্সেস হচ্ছে সেদিন থেকে স্টার্ট করতে পারে শি, ঠিক আছে? সো ইফ দ্য ডে ইজ আ মানডে দেন থার্সডে, এরকম করে টিউসডে, ফ্রাইডে, ওয়েডনেসডে, স্যাটারডে, এরকম করে 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 নিতে হবে ওকে কিন্তু ফর দ্য ফার্স্ট 3 months। দেন আফটার দ্যাট ওয়ান্স আ মান্থ কি ওয়ান্স আ উইক মানে কি ওই মানডে যে স্টার্ট করেছিল নাকি থার্সডে? মানডে, এরকম করে till she wants to take a baby she can continue with that, okay? And what are the I mean effects of this? What are the advantages? তাই জন্য কি হচ্ছে, ওয়েট গেইন হচ্ছে না, নজিয়া ভমিটিং এগুলো সব হচ্ছে না, রাইট? What are the side effects? Non-compliance, disadvantages of non-compliance, ঠিকঠাক এটাতে ছিল।
হ্যাঁ এটাতে ছিল লিভারের এসিআরএম গুলোতে থাকে, লিভারের কি একটা প্রবলেম হয়।
এটাতে নেই, আরেকটাতে আছে, বল কোনটাতে কিসে থাকে বল? নন স্টেরয়েডালি আরেকটা আছে, সেভিস্টার নাম শুনেছিস? সেভিস্টা, that is hepatotoxic, it's not that hepatotoxic, okay? আচ্ছা তাহলে এরকম করে তোদের মাথায় রাখতে হবে, এটা কিন্তু জাস্ট আফটার, আচ্ছা this does not create havoc during lactation, doesn't interfere with the lactational flow, okay? So you can safely give it after delivery, it won't interfere with anything, okay? যেমনি progesterone only pills দিই আমরা, তার সাথে তার জায়গায় you can give a centroman, okay? You can also give an antara. These two things doesn't interfere with the lactation, huh? Okay, what is this? This is government IPL, government IPL. মর্নিং আফটার পিল, হ্যাঁ একটাই হয়, সব লেখা আছে সুন্দর করে, এটা তোদেরকে দেওয়া হবে না হয়তো, হ্যাঁ? তো এটাতে কি থাকে তাহলে? লেভোনর্জেস্ট্রল, কত ডোজে দেখে নে, দেখে বল, দেখে বল। এটা পাস করে দে। 1.5 mg। So this is emergency contraception, okay? How is it used? Within 72 hours of unprotected intercourse, okay? The earlier the better, but the capping is 72 hours, okay? What other emergency contraception we can use other than this? Yes, very good. Ulipristal is also hepatotoxic. Ulipristal is hepatotoxic. আচ্ছা ulipristal কত ডোজে? 60 is the, that is also within
120 hours.
Yes, 120 hours. And mifepristone dose? Mifepristone contraception dose? Emergency contraception বলছি আমরা এটা। We can use ulipristal acetate or mifepristone. Mifepristone আরেকটা নাম কি রে? RU486. Yes, very good. RU486. এটা দেখে আসবি কেন RU486 হোমওয়ার্ক, ঠিক আছে? এটা সব দেখে নিয়েছিস ছায়া? আচ্ছা কি বলছিলাম, হ্যাঁ what else? আচ্ছা কত ডোজে দেওয়া হয় মিফেপ্রিস্টন? 600, বাচ্চা মার দেখি। Now that is a different dose. This you can give by 25 to 60 only. That's the deal. What are the side effects of morning after pill of this LNG? Levonorgestrone? Nausea সবেতেই হয়, সেই ফার্মার মতো নিয়ে আনসার দিচ্ছি। What else? The next cycle will get hampered, yes, affected. She will get delayed menstrual cycle in the next cycle. Okay. And we are left with this one and this one. This one, what is this? This is made up of what are the doses? Dose দেখে বলবি, এইগুলো সব সামনে দিয়ে দেবে, খাপগুলো দেবে না, ওষুধগুলো দিয়ে দেবে। 0.15 is and ethinyl estradiol is, yes. আর কি কি নামে পাওয়া যায় এটা? ফেরাস ফিউমারেট, হ্যাঁ ফেরাস ফিউমারেট হলো, হ্যাঁ 7টা থাকবে। কেন দেওয়া হয় ফেরাস ফিউমারেট? আয়রন ডেফিসিয়েন্সি অ্যানিমিয়াকে কার্টেল করার জন্য। দিস ইজ আ প্যাকেট। দেখ সুন্দর দেওয়া আছে যে কবে থেকে স্টার্ট করতে হবে, ঠিক আছে। আরো একটু অ্যাডভান্স যেগুলো আমরা ইউজ করি, ধর ওভারাল জি, নোভেলন, এগুলোতে মানে মানডে টিউসডে ডে ওয়াইজ সুন্দর লেখা থাকে কবে স্টার্ট করতে হবে, কবে শেষ করতে হবে, ঠিক আছে। এটাও যদি the patient wants contraception, she has to start it from which day? Very good. Day 1 of menses. If she starts from the day 1 of menses and she is having intercourse, she won't be able to conceive. ঠিক আছে, একদম day 1 থেকেই যদি স্টার্ট করো তাহলে she will be completely devoid of any kind of pregnancy like issues. So tell her for contraception advice, you have to start it from your day 1 to day 21 the hormonal pills, and then 7 days তুমি আয়রনটা খাবে, ঠিক আছে। Iron deficiency anemia it prevents. Okay, many of the patients who are having good amount of hemoglobin in their blood, you can tell her to avoid the iron pills only. Okay. So what are the ever bolo indications, contraindications, advantage, disadvantage? Contraindications and all. This also is preventive for endometrial carcinoma and increases breast carcinoma chances. Okay. Acha, what are the non-contraceptive uses? Jimni bollam. So, any kind of abnormal uterine bleeding, beat, any kind of endometriosis, adenomyosis, fibroid, any kind of pathology, uterine pathology, ovarian pathology, dysfunctional uterine bleeding due to the ovulatory cause, you can cyclical করার জন্য ovulatory যদি হয়, PCO থাকে বা কিছু থাকে, you can give this easily. Okay, what are the disadvantages? nausea vomiting হলো, weight gain একটা হয়, breast tenderness হয়, ঠিক আছে, এগুলো হয়, এগুলো হতে পারে। What is this? Male condom also called Nirodh is the government name, right? NHMA. What is it made up of? Latex. Okay. And what are the contraceptive to hoye gelo, that is what are the non-contraceptive uses of condom? Yes, STD. And what else? জানি না তো। আর কি ইউজেস, নন কন্ট্রাসেপটিভ ইউজেস? ইউএসজি কোন প্রোব? ট্রান্স অ্যাবডোমিনাল প্রোব? না, বলতে হবে। ট্রান্স অ্যাবডোমিনাল হাওয়ায় পড়লে হবে নাকি? Transvaginal probe for TBS. আর যেটা ক্যাথেটার বলছিলি সেটা বল, কি বলি ওটাকে? কন্ডম ক্যাথেটার, কন্ডম catheterization. And what else? বলো বলো বলো, আর কি হতে পারে? Any kind of tamponade, right? It is a deflatable thing. You can insert any fluid inside it, so it can be used for uterine tamponade also in case of PPH. If you are not able to find anything in your vicinity, you won't get a bakri balloon always, right? You won't get a catheter also always. You can also, whatever is available with you, you have to make it to use for any emergency purpose. Like if she is having PPH, you will insert water, you will insert the catheter inside, condom inside, and you will deflate it from outside and then act as a uterine tamponade for prevention of PPH. Okay, so that is an important thing. It prevents STI. It is very important to know. মোটামুটি হয়েই গেল। Okay, now the oral contraceptive device, first you have to say this is an oral contraceptive pill in case of mala N. Okay, then you have to tell me the categories of oral contraceptive pills. What are the categories of OCPs? ACRM, ACRM কোথা থেকে আসে? এই সিলেক্টিভ progesterone only pills combined. এটা combined, this is combined. progesterone में मत जाओ। combined में क्या क्या आता है? monophasic, biphasic, triphasic, multiphasic. Okay, these are all multiphasic devices. এখন আমরা levonorgestrel, ethinyl estradiol, we are using this only. Okay, and it has become more advanced nowadays. Earlier motamoti 2 to 3 years back we were very comfortable in using mala N and mala D. Now we are using what? Along with ethinyl estradiol, we are using drosperinone. This is a newer generation. Okay, yes. What does drosperinone do? What are the effects? Third generation. What are the effects? Third generation are these. Those are fourth generation. Fourth generation is drosperinone. Why do we use drosperinone in case of levonorgestrel? Why? What are the side effects are less? Like weight gain. Why na? Drosperinone. It is also known by the names Yasmin, Yaz, okay, Drones, Doris. এইসব নামে পাওয়া যায়। Drosperinone has got Yasmin. It has got anti-androgenic effects. If the patient is having any kind of hirsutism like features, it will help. If she is having any acne like features, it will help. Drosperinone group of drugs. Okay, so we are combining ethinyl estradiol with drosperinone nowadays. অ্যান্টি-অ্যান্ড্রোজেনিক এগুলোতে অ্যান্টি-অ্যান্ড্রোজেনিক বাড়ছে, প্লাস ডোজেস অফ আলট্রা লো ডোজ অফ তোর যেমনি মিনিস, একটা ফাইজারেরই ব্র্যান্ড আমরা ইউজ করি, লোয়েট, মিনিস, এগুলোতে ইথিনিল এস্ট্রাডিওল এতটাই কম আছে, এইটাতে তোর মোটামুটি ওটাতে মিনিসে 0.01, অনেকটাই কম। সো অল দিস ইস্ট্রোজেনিক, প্রোজেস্টেরনিক যা যা তোর মোটামুটি সাইড এফেক্টস গুলো আরোই কমে যায়, ঠিক আছে। কিন্তু এইগুলোর একটা কি হতে পারে সাইড এফেক্ট? স্পটিং, মিড সাইকেল স্পটিং হতে পারে। she can complain of spotting because these are all very ultra low dose. এত ultra low dose এর জন্য কি হচ্ছে, একটা withdrawal bleed হয়ে যায়। হ্যাঁ, এত ultra low dose, but it takes time. She will adapt with many more months, but initially some spotting is found with these ultra low dose pills. Okay, So that is all.
Thank you, ma'am.